PCOS, or polycystic ovarian syndrome, oftentimes comes with more questions than answers. We'll look no further and get all of your questions answered in this Ask Me Anything Live, where I talk with a student physical therapist, Mahek, in India, who not only has cured her own PCOS, but also delves into things like low libido and if PCOS puts you at a higher likelihood for ovarian cancer. Hi, my name is Meihofer, and on this channel, I help you gain health through knowledge and movement. So I have always been really interested in anatomy and really interested in some of these taboo topics. So growing up, when we learned about sexually transmitted diseases, infections, I was always the kid that wanted to know all about it. And in PT school, we had two women come and talk to us about the pelvic floor, and I was so fascinated. And I thought, you know what? I really want to know more about this. And I saw how many women were truly suffering. Ability to make them feel at ease. So that's why I went into it, because I realized that I could make people feel comfortable and open up really quickly.
That's great. We need more people like you.
Thank you.
So before talking about PCOS, I would like you to tell us something about pelvic floor physiotherapy.
Yes. So I know you're a physical therapy student. So I'm really interested to know, how long do you guys have to go to school to become a physical therapist?
In India, it's a 4.5-year course.
Wow.
A bachelor's course. Yeah.
Wow, that's really awesome. So one of the things I think that's a big misconception is that only certain people can be pelvic floor physical therapists. So I kind of do air quotations, because really I think any person who is a physical therapist should be treating and screening the pelvic floor. So my boyfriend actually is also a physical therapist. He treats kind of general outpatient orthopedics, but I have trained him how to screen and assess the pelvic floor in a way that is all doing it kind of over the clothes or talking to the person and using special screening things. So I would say to any of your fellow classmates or to any patients or clients who are listening to this, if you are someone who has low back pain, abdominal pain, or hip pain, make sure that your physical therapist is taking time to talk to you about your pelvic floor. Okay. And if you're a physical therapy student, make sure that you don't say, oh, just because I don't treat the pelvic floor, I'm just going to ignore it. Because if someone has a shoulder issue, you wouldn't ignore the neck. You would want to screen the neck as well. So the same is true with the pelvic floor. So that's my big pearl of knowledge.
Yeah, that's nice. And pelvic floor is like a foundation of the body. And so, I really agree to it that it should be taken into consideration before talking about other body parts and limbs. So, and
I suppose, Mahek, can I say one thing?
Yeah.
So in case some people don't know, because of course we might have some non-physical therapists joining us today, the pelvic floor is a group of 26 muscles. These 26 muscles attach at the very front of your pubic bone. So when you're sitting facing the camera right now or your cell phone, if you take your hand at your belly button and walk it all the way down to that firm bone that you feel, that's your pubic bone. Those 26 muscles sling like a hammock and attach into your tailbone at your back or bottom of your spine. and they have 5 major functions. They help to hold your organs up and inside of your body. They deal with sexual appreciation, which of course is always the most fun thing to talk about.
Yeah.
They deal with our urinary incontinence and our bowel continence. They help to pump fluids through our system, and then they also act as support for the pelvic organs. So I forgot to mention that piece for our talk today.
I was gonna ask you about it actually.
Yes.
To explain
Yes.
us what pelvic floor is. Yeah.
Yes. So, and the nice thing is, as you mentioned, I have the blog and then also the YouTube channel. So both of those things, the YouTube channel has a playlist, New to the Pelvic Floor, Start Here, where I go through that exact same thing. And then my blog also has a thing that explains what's normal pelvic floor function and what's abnormal pelvic floor function. So I think it's really important to give people multiple ways to learn about their pelvic floor, whether it's video, whether it's written, different things like that.
Yeah, that's great. So, what's your definition of PCOS and how physiotherapy can help overcome it?
Yes. So PCOS is known as polycystic ovarian syndrome. And I would say it is something here in the United States that oftentimes goes undetected for a very, very long period of time.
Yeah.
I pulled up my blog on it because I had a couple of facts in there. But about 1 in 10 women between the age of 15 and 45 have PCOS. Okay, so it's not a huge number when you think 1 in 10, but I think the shocking thing to me is that of that person, of that group of people, 50 to 70% of those people don't even know that they have it.
Yeah, exactly.
And so that's what really kind of freaks me out, is because if we don't know what's going on in our bodies, how can we live a good and full life? So what PCOS is basically your ovaries produce too much hormones. And as a result, you get cysts on the ovaries, and they can be painful when they grow and burst. So that's kind of the very overarching definition. But I think the thing that's more interesting to people is what are some of the symptoms that you can look for. So some of the symptoms of PCOS can be missed, irregular, or prolonged menstrual cycles, really painful menstrual cycles, acne, oily skin, thinning of your hair, having excessive hair growth, weight gain, skin tags on your neck or your armpits, darkening of the skin in the neck, groin, armpit area underneath your chest, and then constant or intermittent pelvic or abdominal pain. So the challenge is that many of these symptoms are kind of random. So being aware of what they are and advocating for yourself, because the doctor has to be able to pull those all together. And it could be, I have irregular periods and I have skin tags, and that might be the only thing. And that can play into your fertility. So kind of a long answer, but yes.
Yeah, actually people need to know what the symptoms are, because I also had PCOS. Like I have PCOS, and earlier I was very confused, like why this is happening, why am I having anxiety, why my hair are falling out. So people need to have this clear, information.
And so when were you diagnosed? If
I
you
was
don't mind me asking.
I was diagnosed in 2017 when I was in high school. Yeah.
Okay. And was it you going to your doctor and saying something's going on with me? These are my symptoms, or how did they, I think it's interesting to kind of know from a patient perspective how you got this diagnosis, because I have so many women who it's missed.
Yeah, actually, I was really confused. Like, I never had my periods missed. I had my periods regular, but I was having this stress in my mind, and my high school was going on, and I was having a coaching for medical, for entrance exam
Mm-hmm.
that time. So that because of that, I think my periods didn't come, and I was really more stressed about it. So I told my parents, and then I went to the doctor, my gynae,
Mm-hmm.
and so I got it diagnosed. I got my ultrasound, and there I saw cysts and all. I was so shocked, like what's happening to my body. And so the
Mm-hmm.
doctor little bit explained to my parents. I was just standing there. I was very nervous that time. So she gave me contraceptive pills. I didn't know what they were. I took them for 2 months, and I was like, okay, now I have to take them. Then after a while, I'll be fine. But my symptoms weren't going away. And
Mm-hmm.
so I decided to know more about this and to take care of myself much better and to spread
Good.
awareness also. Yeah.
That's so awesome. That's so, so awesome. So, I'm interested to know again, what are some of the things that you did to take better care of yourself?
First of all, I wanted to know the why of everything. If I know what's happening and why it's
Mm-hmm.
happening, I can, take the reason and cure it. So I cured my acne, I cured my hair fall, my hair thinning, my facial hair almost, and I lost weight. I went into I didn't take any contraceptives. I stopped taking contraceptives, and I went to the Ayurvedic holistic way. I took a few of the medicines, and yeah, I'm glad that I cured the acne, especially because of acne, my confidence, my everything got low. And because of
Yeah.
PCOS, I had a thyroid problem also, hypothyroidism. My voice is cracky, I know, because of that. And then I'm still taking thyroid pills. And I had vitamin D deficiency, a lot
Mm-hmm.
vitamin D deficiency. And I couldn't even stand. And that was a major problem I was facing because I had a lab in my college. I had to go to lab. I had to attend clinics and
Mm-hmm.
everything. So it was really problematic for me. So that time
So,
I decided that I'll go to
yeah,
Ayurveda and create awareness, treat myself.
I love it. So,
Yeah.
you really highlighted, honestly, one of the reasons why I created the my website laurameihofer.com and why I do all of this stuff is because the first thing you said was I needed to gain knowledge about the issue.
Yeah.
And that is one of the things. So, like this blog post, this is just one. And then our plan is over the next months, over the next years, is we'll continue to release more information about these different pelvic floor topics. And I would love to come back on your channel and continue to talk about stuff because it's that awareness and that people have trouble finding that information. So you're clearly very smart, you're educated, so you were able to find that. The other thing that I find super fascinating about sharing your story, which thank you for sharing that, and your resiliency in it, is I think it's so interesting because you are in India versus here in the United States. A lot of times people just want to take a pill. And having a yoga background, part of my yoga training was learning about Ayurvedic medicine. And so I love that you did that. I think that's so amazing because you can heal a lot of things with doing these amazing natural changes. And so I had to give you claps for that because that's so
Thank you.
amazing.
Thank you
And
very much.
I'm like totally jealous because I wish over here in the United States, it is very hard to find Ayurvedic practitioners. Like it's nearly impossible.
Yeah.
I think it's amazing.
Thank you. And also, I did dietary changes and I did yoga also. Meditation really helped me. So
That's
yeah,
awesome.
what's your inspiration of learning yoga?
Okay, so my inspiration for learning yoga was as I was treating, and this actually ties into one of the questions you asked earlier that I hadn't answered yet, which was how can pelvic floor physical therapy or physical therapy in general help individuals with PCOS? So, one of the things that can be part of PCOS, one of the symptoms I talked about was painful periods or just having intermittent or constant abdominal pain. So when you have these cysts on your ovaries, it can be constantly irritating, almost like I explain it to people like if you have a tag on your t-shirt, like my t-shirt has like a tag back
Yeah.
here, and if it's
Yeah.
constantly rubbing and aggravating, your muscles as a result tighten and hold. And so if we can find ways to help relax that. So what I found, again, in Western culture in the United States, we are very, very like go, 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 type A people. We don't stop. If we go to yoga, we don't do the meditation part. We don't do any of the relaxing things. We do it as an exercise to
Exercise,
sweat.
yeah.
Yes. And so
Vinayasa.
go
Yeah.
ahead.
Yeah, actually, in the last live I did with the yoga instructor, and she told that there's a form of yoga called Vinayasa, which is a type of exercise yoga. So I just wanted to add that.
Yes, yes. So we do yoga with people will do yoga with weights. And they'll be like, and now that you're in warrior, pump, pump, pump. And I'm like, this is not yoga, people.
Yeah.
So
Yeah.
I found that because my patients were so high energy, and I had the luck to go to some yoga classes where the people were more relaxed, and I felt the positive effects of it, I decided let's start to bring that into my patients. So I started doing more restorative yoga. So having them support themselves with props like bolsters, yoga blocks, chairs, everything, and get into these really restorative poses like child's pose or a modified happy baby. And then I found that in getting in those poses and then teaching them how to do deep breathing, we were able to get the pelvic floor to relax and move, and we were able to move those abdominal organs, and so it helped with their pain. So that's what honestly was kind of my way of getting my patients, my pelvic floor patients, sort of got me hooked into yoga, and then I went and got further training. But definitely I would say the yoga that I experience versus the yoga that you experience, I'm guessing yours is, not I'm guessing, I know yours is much richer and way more awesome than what we have here.
Thank you, and it's great that you are trying to give America that type of yoga. I'm really happy
Yes.
about it.
So if
Actually,
you,
it
again,
has.
go ahead.
Yeah, you go ahead.
I was going to say, like, so some examples, if you go onto my YouTube channel, there's a playlist called Yoga for the Pelvic Floor, and it shows some of the ways that I will have people modify to do stretches like happy baby or pigeon pose, bound ankle pose. Those kind of open, are the things that seem to really help the pelvic floor for individuals with PCOS and for individuals who have painful or tight pelvic floors.
Okay, great. So let's move on to a very private topic, female masturbation, and
Yes.
how can masturbation be helpful in treating PCOS or help in PCOS?
Yes. So, I love this question. So one of the things that I think is awesome about masturbation is it's really about self-discovery. So, I'm not sure how it is kind of in India, but here in America,
It's a taboo. It's a big taboo. Yeah.
Yes. It is. It can be something that is filled with a lot of shame. So
Yeah.
I try to reframe it, and instead of thinking of it as, oh, it's this thing that I'm seeking pleasure, I instead like to frame it as this is self-care and self-exploration, almost like a massage.
Yeah.
So I'm introducing or wanting someone to work on this masturbation, this self-care, this massage. I will explain that when we have orgasm, when we have pleasure to this area, our pelvic floor has increased blood flow. Increased blood flow causes more warmth to come into the area, and with more warmth, we get the muscles to relax.
Relax. Yeah.
Yes, and we can get the not just the muscles, but the connective tissue to be able to slide and glide and stretch more easily. And so that's what we're really going after when we're doing this masturbation. So I like to explain, here's what happens when you get aroused. And here are the positive effects. You get stretching, you get warmth, you get relaxation, you get flexibility. And so when they think about masturbation, they think, oh, I'm doing all of these things. It's like yoga for the pelvic floor. That's what I kind of pitch it as. And so then it's not so shame-filled. In addition to it being like yoga for the pelvic floor, I also explain it's a great way to start to become more aware of what's going on down there.
Yeah.
You know, if you ask me to close my eyes and describe my face, I could describe it super easily. But if you were to ask a woman to describe her vulva, she's not going to be able to understand that area of her body because we don't look at it, we don't touch it, we don't really interact with it. And so I like to use masturbation as like this way to kind of explore and get to know what's happening down there. So I'll have people do simple things like taking like coconut oil and just like kind of moisturizing the area and stretching and massaging and not even thinking about it as something that's going to bring them pleasure, but with time they can start to relax and get more of those benefits, which is then going to lead to better orgasms, better intimacy with their partner, things like that.
Yeah. And this will help women with vaginismus, I think.
Yes, I know. This was something we could do a whole Instagram live. I was going to message you about that to see if you wanted to do like a whole IG live on vaginismus. So individuals who have vaginismus, just for, again, to kind of get everyone on the same page, is an involuntary contraction of those pelvic floor muscles when something is near the opening of the vagina. And that it can be extremely painful because your muscles are tightening, those 26 muscles are tightening as hard as they can. So working with a pelvic floor physical therapist, getting to know your body better, being able to touch that area of your body in a way that is, there's no expectation for pleasure, there's no expectation for penetration, anything like that, will start to help you gain confidence and relax. Now, I have a question for you, Mahek. Do you, in India, are you guys able to use dilators at all?
Yeah. But not in the small villages or small places. In the large cities, yes, there are doctors, but many people don't even know. They think that if we talk about it, what will people think about us? So
Right.
it's like a taboo. Many people don't even talk about it and don't know and don't even talk with the partners also. But there is treatment in large cities, in big cities, not in small places.
Okay, that's really good to know, because I was wondering about that. And then here I'm going to grab something from my closet really quick to show you. Hang on one sec.
Okay.
you guys ever work? Okay, I'm back. Sorry. Do you guys ever work with like things like this where they're flexible dilators? No.
No,
No.
not the students.
Not the student, or but like as the physical therapist, do they ever, when they're working with vaginismus, do they ever tell patients to get these to work on
I don't
stretching?
know about it. Actually, I don't know
No.
about it.
Okay,
I
I'll
know
have
that
to.
there are dilators. I know that there are
Yes.
dilators. I have seen the photo, but I have never personally seen or touch it or talk, or I have like talked with someone about it in India. I saw
Okay.
some videos where a girl was answering the questions when people emailed them, and
Yes.
she told that there is vaginismus,
Okay.
something. So from that video, I got to know. Then I researched about it, and there was a day also, National Vaginismus Awareness Day,
Yes.
and so I got to know about it more clearly.
Good. That's awesome. So yeah, maybe you and I can talk offline, and you can like gather questions with friends or whatever,
Yeah.
people in your area, and we could do like an IG live on that or something, because that has a ton of information that I'd love to cover with you.
Sure, we'll do it.
Yes.
So yeah, moving on to another question. With PCOS, women have sudden sexual urges. So how can we help them as a physiotherapist?
Yes. So the biggest thing is being aware of the anatomy. So as I was saying, explaining, okay, this is where your pelvic floor is located, showing them with a pelvis model, which I would totally go grab mine. It's in the other room though, and I don't want to leave you again. So showing them where is their pelvic floor, but then also showing them where is their uterus and where are their ovaries and where does that sit within their body. Because I think the more people can visualize what their anatomy is, the better that they can understand why they're maybe having pain, why they're having discomfort, and also the more they understand about the roles of the hormones in their body. So some of the things that can happen with PCOS is you can have lower libido. And just because you have low libido does not mean that you don't have those sexual urges. It just might mean you have to plan for it a little bit more, or it might mean you have to spend a bit more time in foreplay or something like that. So with PT, what I do is I will explain to people, say someone comes in PCOS and they're reporting, I really have low libido. I really don't feel very sexual when my partner kind of comes to me. I'm not really feeling it. So I will explain to them, okay, let's start to help you better understand, when do you feel more sexual? For some people, it can be the timing is off. So maybe they feel more energized in the morning and their partner is feeling it more in the evening. Maybe they're running through a lot of things in their head. Like you were saying, meditation really helped you. So that's something I might have people do, is work on meditation, and can we slow these thoughts down to get some better awareness so you can be in the present moment. I'm not sure how this is over in India, but here in America, body image issues are very huge with individuals. So helping them feel comfortable and confident and letting them know their body is normal and beautiful can help with that piece of things. If we have the flip side, where someone maybe has a very high or normal libido, then we can start to work on, and maybe they are or they're not with a partner, we can start to work on how can they explore that normal libido. What are things that that they like to do with their partner? So on my YouTube channel, at the top is a banner, and there's like a link for my website and Instagram. There's another link up there for a pleasure quiz. And you can sign up. It's free, but it helps you understand, what do you like to do? What is enjoying to you? So for example, I love holding hands. My boyfriend hates holding hands. So we can have a better understanding of what does he like and what do I like. And you can do it if you're with a partner and if you're not with a partner. So we start to, again, gain awareness of anatomy, gain awareness of ourselves, so that we can then create these interventions to help the individual. So maybe you're with someone and they really love to make out or whatever, and maybe you're not into it, or maybe they have bad breath and you don't feel comfortable telling them. But maybe as a PT, we come up and we figure it out and we're like, oh, you're not feeling very sexual because your partner has bad breath. Well, can we get some mouthwash in the house? You know, it can be very simple fixes sometimes, or it can be larger ones.
Yeah, yeah. And with meditation, we can really control our hormones. I have seen, because I had high testosterone levels, and I suddenly used to get sexual urges, like suddenly that twitching and all. And I was really confused why this happening. And after the meditation, I was feeling so good, and I still feel so good after the meditation. Whenever I do, my anger, my sudden emotions, my sadness, I used to cry suddenly. While I was sitting normally, I used to cry. So, and I was hysterical. Sometimes I was very happy, laugh and cry. So meditation really helped me in this.
Yes,
And
meditation is huge.
Yeah, and I think women who have hard time getting orgasm, we meditation is also helpful for them, as you said, and
Yes.
proper counseling. Yeah.
Yeah. So it's very easy with meditation. There are two things that are happening. I mean, again, I think over in India, it's going to be way richer, and you guys know way more about it than I do. But from my perspective, when I'm teaching a patient, there are two things that I'm focusing on. One, when we're doing the meditation and we're slowing our breath, the pelvic floor and the diaphragm run parallel with each other. So when you slow your breath down and you take a nice deep breath in, the diaphragm comes down and it helps to stretch the pelvic floor. And so when we do this nice, lovely breathing, and when we slow this down, and with meditation, that's where you're getting that slowing breath. We're going to stretch that pelvic floor, and we're going to help to calm that nervous system and get some more stretch and flexibility. And then the second thing is, when you're doing meditation and you slow your breath down to about 6 breaths a minute, we know that triggers the brain to go into the rest and repose response, the parasympathetic response, and that helps to down regulate the system or calm the system down. So again, to my American people, I will say these are the two things we're going after with meditation. Again, over in India, I know you guys have so much richer experience with that. Over here in America, I'm like, can you please just give me 3 minutes of meditation? And that's like what I can get. So yeah, so I love that you shared that.
That's great. So heading on to the next question. PCOS leading to ovarian and pelvic cancer. So what are your thoughts about it, and how physiotherapy can play a role in reducing the chances of cancer?
Yes. Yeah. So actually, you're the second person that has asked about specifically if PCOS can increase or decrease that risk with ovarian cancer. And I think I was actually talking with a researcher kind of offline as well, and they said that the research can be really split on if it does or doesn't lead to more ovarian cancer. I personally think the biggest thing is, looking at the signs and symptoms of ovarian cancer, so that you know, okay, here are my PCOS symptoms. Make sure you're really aware of those. And then if any of those symptoms change and fall within those ovarian cancer symptoms, which I can pull up because I just wrote a blog on that a week or so ago. But seeing if those change, and if they stick around for 2 weeks, then you need to go in and get the scans like you did to see, has something changed? Because truly, with PCOS, because you have those cysts on your ovaries, if you're going in and if you're getting treated, and if you're watching and observing those, you can see if they're increasing in size or decreasing in size. And so if they're starting to increase in size, and you're doing your Ayurvedic stuff, you're doing your meditation, you're doing your medication, and they're not changing, then we need to step up and we need to do like a biopsy of that ovary. So it's kind of twofold. It's, again, being aware of what are the ovarian cancer symptoms, which I'll find in one moment. And then 2, it's making sure that you're really aware of your PCOS and that you are doing everything you can to treat it, and that you're monitoring it with your doctor. And if it's not changing, don't let the doctor tell you, oh, don't worry about it, we'll just check back in. And it's like, I've been doing all of this stuff and I'm not getting any better. We need to get another test then. I think that's what I oftentimes see is, here again, and I'm not sure in India, but here in the United States, sometimes doctors will discredit the woman who's going through it and will say, I think I know better than you. And really, as you know, going through what you've gone through, Mahek, you're the expert in your own body. So if things are not getting better, but you're doing everything they're telling you, and those cysts are continuing to get bigger, then you need to have them biopsied so that we make sure it's not cancerous.
Yeah.
Does that make sense?
Yeah, absolutely. In India also, doctors are like that. Oh, if you don't want to get pregnant right now, you just take contraceptive pills. It's okay to have. It's very natural. They say it's natural to have PCOS, as many people are having it. It's absolutely not. It's a more complex thing, and it needs to be worried about.
Yes. Yep. Like I said, claps to that. And then just so people know, so it was 2 weeks ago that I wrote a quick, no wait, that's chronic pelvic pain. Sorry, I clicked on the wrong one. Last week, I wrote Understanding Ovarian Cancer, and then Preparation for Early Detection. And the signs and symptoms for ovarian cancer is abnormal bleeding or discharge from the vagina, pelvic pain or pressure, feeling full quickly or trouble eating, upset stomach or heartburn, urge incontinence, so that's where you have a strong urge to go to the bathroom and you can't make it there in time, constipation, abdominal bloating or swelling, unexplained weight loss, back pain, pain during sex, and fatigue. So, again, the symptoms can be really broad, but if they're sticking around for 2 weeks and you've tried normal means to try to make them better, and it's not getting better, like say I have constipation and I'm taking medicine to help me not have constipation and it's lasted now for 2 weeks, I need to go into my doctor and you need to get further testing, and do not let them shove you out the door, because that's where things get missed.
Yeah, we need to take care about it.
Are most of the physicians in India male?
Yeah, but female physicians are also there. Like mostly gynaes are mostly females. We hardly see any, male gynae. Yeah.
Good. Yeah, because I feel like the stories that I've heard a lot of times of women who aren't being listened to, it tends to be the men that will say, oh, just do this thing, or oh, your period, the cramps aren't that bad, or oh, the bleeding's not that bad.
Yeah.
And if you are filling a pad or a tampon in less than 2 hours, that's excessive. and you need to get help. So
Yes.
I recommend documenting, like writing down, like taking notes. So you have like a symptom journal. So I'll have a patient just like print off a calendar and they'll just write down their symptoms on the calendar, and then they can bring that into their doctor to kind of show proof, and to show the how the symptoms have sort of progressed. It sounds like you had a really supportive mom and dad who helped you with
Yeah.
that. That's what I have. I have a very supportive mom and dad as well. And my mom used to always take notes, and then she would come in with a notepad of paper and she would be like, okay, here are all of my questions. I'm not leaving until these get answered. And so I really recommend that people write down, because doctors will say, are you sure it's been going on for 2 weeks? And if you took notes and you look back at your calendar and you say, actually, it's been going on for a month, then they're going to take you more seriously, because you have the proof to show what you're going through.
Yeah.
And I know doctors are wonderful people, but they have to see a lot of patients in a short period of time. So the more information you give them right away, the quicker they can go through their decision tree, and the more likely that you're going to get the help you deserve and need.
Yeah. Right. Right. And and suggest some exercises or yoga for
Yes.
lean PCOS and obese PCOS, and also for women who are trying to conceive.
Yes. So I love this question. So I'm going to plug that playlist that I talked about. My YouTube channel is Laura Meihofer, LLC. I can put it in the comment section really quick. And
I pinned down that. Yeah.
Yes, I got it right. There we go. So that has a whole thing called yoga for your pelvic floor. But I would say my favorite postures are bound angle pose. So you probably know like the actual names. I feel so embarrassed talking to you because you're probably like so much more knowledgeable about it. But basically, let's see. I have myself on a little tripod here. So you sit like this, okay?
This is a butterfly pose, I think.
Yep. And then you lay backwards, like, so you're like laying flat, but then your feet are together and your legs are out. I love that because you're going to get a gentle inner thigh stretch. It's nice and opening for the pelvic floor. And you can really put your hands on your chest and your belly and focus on some nice deep breathing. Sometimes I'll have people put like a pillow under their head or elevate their back a little bit. So they're kind of in like a 45-degree angle. So it's like really just beautifully supportive. And then you can hang out there for like 5 minutes. I like that one. I love child's pose, but again, with child's pose, I will oftentimes put support underneath my chest. Or if my knees don't like bending all of the way, like I like to really support myself there because I want people to hang out in these postures for a minimum of 90 seconds, but longer if you can do it. So I like that one. This is one that I don't have on my YouTube channel, but I love legs up the wall. So laying on your back, and then I like to have people elevate their pelvis on like some pillows, or like if they can kind of create a little ramp, and then put their feet up on the wall. I like that because it kind of like helps with some like swelling. It helps with like if you're dealing with any like pelvic congestion, it can really kind of help tip things back. And then lastly, I'm a huge fan of Happy Baby, but again, I'll use like a yoga strap or different things so that I can relax into it and just hang out there for like at least 90 seconds, if not more. And then I want to make sure that my jaw and shoulders and everything else is relaxed, and breathe. And I love that one because your tummy is out of the way. So if you are dealing with kind of a bigger tummy potentially, that's not going to be a problem because your leg is like way out to the side. I love it for fertility. piece of things, because again, it's going to work on relaxing the pelvic floor, opening the hips, really kind of opening that area of our body, focusing on the breathing. And so, and I think it's a really powerful pose for women. So those are what I would say the more restorative poses would be. The other posture I like is, I call it goddess. Basically your legs are like out wide, like in a squat, like, let's see. Don't worry, we will figure this out. Okay, let's see. So your legs are out wide like this and you go down. Okay. And I love that, but you go down till you feel a stretch in your inner thighs. I like that one because it's a bit more active and you can even kind of pulse up and down. So it really increases the heat in your body and it really like helps to muscle pump the pelvic floor. And so again, I think it can really help with that libido, arousal, and that sexual energy because it's a very open pose, yet it's a very powerful pose for women. So I really like, those are the ones I like.
That's great. That's the last one will also strengthen the pelvic floor and upper body.
Yes.
Yeah.
Yes. And so, and I think that's huge.
And one more asana, one more pose I'm going to add, which I used to do. It's called Chakki Chala Asana, where we sit. Yeah, it's in Hindi actually. I don't know the English name, but in that we will move while doing it. So what's that? Like we have to sit on the floor and we have to open our legs wide and straighten our body. And then we have to straighten our arms and do like this. It's like moving like this. This one.
Yes. Yes.
You have to bend over and move.
Yes.
So this really helped me. Yeah.
Yes, that's awesome. So I really like, and again, it really can show this cultural difference. For me, I'm oftentimes showing people, and I'm their first introduction to yoga. So when you look at my, I think I have 3 yoga flows. They're very, very simple, because people are just learning it for the first time. And I love, eventually getting to a space with my clients where I'll create a specific yoga flow for them. So I'll video myself and I'll say, I want you, client A, to do this before intercourse or after intercourse or before a pelvic exam. And that's where it's really, really fun. But a lot of times what you'll see for me is I just give people snapshots of poses and I love that movement that you talked about. And I think that's what's so huge. So thank you for sharing that.
Thank you. And and one other question we have. How technology helped you in treating patients, and what would you suggest women with PCOS and their pros and cons, that basically the technology?
So some of the things that I recommend for people to do is to follow hashtags like PCOS warrior, PCOS awareness, all of those things. It's so nice because you can start to see who are influencers in that area, who's giving out good information, and you can find someone who might be doing something that you haven't yet tried. So, for instance, like you sharing about doing Ayurveda, if someone is not having the results that they want by doing medicine, then finding an Ayurvedic practitioner might be something that's helpful to them. So I think that's huge. The other thing I recommend patients to do is period tracking apps on their phone, because a lot of times PCOS is marked by irregular periods, whether that's no period or a super heavy period or a super painful period. You can again start to document, and then that gives you more information for your provider. So those would be like the 2 big things that I tell people to do.
Okay. And in technology, we can talk about the devices which you will recommend. Like I read in your blog about vibrators and all. So which will help activate the pelvic floor more.
Yes.
So
yes,
what are
yes,
you going to
yes.
say about it?
Yes. So I really, really like vibrators to help to get a couple of things. One, I like them to help get that relaxation and flexibility to those muscles. So thinking of them outside of using them for sexual pleasure. But then I also like them as a way to help with that self-exploration and that sexual pleasure. So on my website, one of my favorite ones, and also on my YouTube channel, this is even better. I have this, How to Choose a Vibrator is the title. And it talks about the specific vibrator that kind of has a curve, and you can use it inside and outside. And so that's really great because it can help to make your muscles so they have more regulation, so you can contract them and you can have orgasm and all of that stuff. But it can also work to help relax them and help release tension. So I like vibrators because they can achieve both of those things based on how you're using them.
Yes.
And I'm going to be so one thing, signing up for my email list is a great way because I'm going to start in November, I'm going to start releasing online workshops or webinars that people can download and take at their own take themselves. And so you can do it in the privacy of your home. And so I haven't announced this yet, but one of the classes in November will be how to pick a vibrator. And I'll go through all things about the different types of vibrators and how to use them and all of that stuff. So a great way to stay up to date on that is signing up for my email list. And you can do that on my website.
Okay, so my audience who are listening, you can go check out her website and blog, and you can sign into the mail list, and I'm gonna do it.
Perfect.
So,
yes, it's super easy. There's lots of different ways to do it. Whether you go onto my Instagram account, there's a link in the bio there. Like I said, on my YouTube channel, if you do that, you can get the free pleasure quiz. If you go on to my website on the home page and you scroll down, you can subscribe there as well. So lots of ways to connect. And if you have any questions, you can always direct message me.
Yeah. So the last and most important question is how to know your pelvic floor muscles are tight or loose. So how do you know that? Any physical form from which we can know?
Yes. So if you are having pain, and if that pain is coupled with like urinary incontinence or something like that, or even if you just have pain, then most likely your pelvic floor is overly tight. A lot of times people think when they're leaking urine that their pelvic floor muscles are weak, but most often what I'm seeing is they're too tight. So that's one thing. The other way to do it is you can check to see if I tighten my pelvic floor, like if I pretend to stop the flow of urine, does my pelvic floor lift? And then if I release and let go of that, does my pelvic floor relax? And then if I bear down, like I'm trying to push something out, does my pelvic floor actually move down? So you can kind of check your own range of motion. And if it doesn't move very much, then your pelvic floor is overly tight.
Yeah. That was the first exercise I got to know for pelvic floor strengthening. And I used to do it. And in one blog, I read about vaginal tightening. And those who have a loose vagina after the childbirth, they used to practice this. Like holding the urine for a few seconds and relaxing.
Yep.
That was really good.
Yeah, and the thing is that people oftentimes, like I said, get really confused because they always think that their pelvic floor muscles are weak. But what I see is oftentimes their pelvic floor muscles are overly tight or they're not coordinating correctly. So it's that ability to coordinate and that ability to relax that's more important than how tightly you can contract.
Yeah. And also, if the pelvic floor muscles are tight, we have the pelvic tilt also, I think. And the spine will, because I have that anterior pelvic tilt. And my
Yep.
mother has, like, naturally she has, so I think I also have that.
Mm-hmm.
But my back pain was very much, I think last year, I was
Mm-hmm.
having a lot of back pain, all the time back pain. And I discovered that vitamin D deficiency also leads to back pain. So
Mm-hmm.
I had a vitamin D course, and my back pain vanished. I did some yoga, stretching, and little bit exercises. So it really
Awesome.
helped me. Yeah.
That's awesome. That's so awesome. I love
Yeah.
hearing that.
So I think the questions are over now. And
Perfect.
I thank you for
Yes.
taking your time out and joining this live with me. Thank
Thank
you.
you.